Good morning, everyone. Welcome to Mercy. My name is Farron Mannion, and I'm from the Department of Medicine at Mercy Hospital, St. Louis. Really appreciate everyone being here today. This is our second annual symposium, meeting and where they are toward better healthcare for our unhoused population of people. Last year, we had a really successful program because of you guys and many others. And so we decided to go ahead and repeat it this year. And again, it's just really great to see everybody here. Before I get started, I asked Sister Janet Crane, who's one of the sisters that's at the Mercy Hospital St. Louis here, to start us off with a prayer. Sister?
So I thought that since we're really about the human works of mercy, that we would begin our prayer. Every faith tradition, or maybe traditions that we're not familiar with, or maybe people who don't have any tradition, this is what makes us, where are we? This is what makes us human. And this is what we're going to talk about. And I truly believe that everybody in this room is taking these works of mercy very seriously. And maybe you never had a name for them, but here they are. They're the ones that care for the body, but also care for the spirit as well. So as we begin today, our prayer is about strengthening ourselves in our learning and our doing. So let us pray. Loving God, who loves us so well, we ask that we may be blessed to see and hear and be with our sisters and brothers who look to us for mercy. We know how you love our family in need. Give us the heart and courage to seek out people who are waiting to be cared for by us in these human works of mercy. In the words of preachers, prophets, people of devotion, and maybe the people we care for too, you have reminded us that works of mercy form us into your likeness. May we respond as a blessing to everyone, everywhere, and at every opportunity. And so we pray, and the people said, Amen. Thank you, and have a blessed day.
Sister. Thank you, Sister. Appreciate it. Next, I asked our county executive, Sam Page, Dr. Sam Page, to say a few words. Sam and I have known each other for many years. He's been an amazing colleague, friend, and used to be my resident one time. I'm not going to tell you what year it was, but he's been amazing. He's an anesthesiologist by trade, and he's been our county executive for the past 5+ years. So thank you, Sam, for everything you've been doing for us, not just for Mercy, but for our community in general, and really appreciate your presence today.
Thanks, Farron. We spent a lot of time together over the years in the hallways and the ICUs to Mercy, and learned a bit along the way, that's for sure. And I won't tell you what year you started, but I started in 1992 as a student here, and that was a long time ago. I see a lot of friends in the audience, and it's good to be here, and I do appreciate the invitation. You're doing great work. Healthcare should be a right for everybody, but we know that obstacles still remain for a lot of people in our community. Sometimes it's lack of insurance, sometimes it's mistrust in the system, sometimes it's a bad experience, but there are obstacles. And compounding these challenges is the historic disinvestment in public health. Healthcare funding at the state and the federal level over the past few years have seen really some drastic cuts, making access for the most vulnerable really, really challenging, if not impossible. And at the county level, even this year, we've seen some significant cuts to public health, which will very definitely impact the services that we can provide unless supplemental funds are appropriated by the county council in the next few months. Among our most vulnerable are those who are unhoused. And bitter cold temperatures that visit us this time of the year really put their lives at risk. We can certainly see some fatal circumstances. We see our unhoused take shelter wherever they can, and sometimes that's in our hospital emergency rooms. But it's more about access to a warm place to rest than it is about health care. And it's a vexing problem getting care to those who often have a myriad of mental and physical challenges. The lack of affordable housing across the country is absolutely exacerbating this problem. And we've been challenged along the way by decades of underfunding of our social services, which have reduced and sometimes, in some cases, have eliminated our social safety nets. I'm grateful for Mercy's commitment to this second annual symposium addressing the needs of the unhoused, especially the healthcare needs. And I'm glad to be here to be a part of it again this year. As a medical doctor and as an elected leader, I certainly have a unique perspective on this challenge. If we can provide stable housing, we can improve our health outcomes. If we can coordinate our efforts, then we can reach more people more effectively. And if we can make public health a priority, then we'll have a healthier and more productive community. When we bring experts in this field together to talk about these challenges, then we're a step closer to implementing our best practices, to getting the lives of our most vulnerable into a better place. I'm proud of the work we're doing in St. Louis County with very limited resources. We're the only county in the state that provides direct care to its residents. Dr. Kanika Cunningham is the director of the county Department of Public Health, and she also runs our 3 clinics. She'll be here this afternoon on one of your panels. We take care of the uninsured and the underinsured. No one is turned away. But we know despite our outreach efforts, not everyone is getting the care that they need. But it's not from a lack of trying. Last year, after 5 years of work, our St. Louis County health clinics obtained FQHC status. That's a special designation, as many of you know, from the Health Services and Resources Administration that allows us to access expanded Medicaid and Medicare reimbursement, allows us to increase the services we provide, and gives us access to discounted medications. St. Louis County is the first FQHC lookalike in a public institution in the state. This certainly emphasizes our commitment to providing care for the uninsured and the uninsured. I appreciate the work that everybody in this room is doing. I'm really proud of your work. I know Dr. Mannion, Dr. Krause, I know a lot of you folks personally and your commitment. This challenge that's in front of us, it's going to take everyone. It's going to take everyone working together to make a sustained difference in our community to improve the healthcare for the unhoused. Thanks for letting me join you today. Know that I'm cheering you on, and we consider St. Louis County a partner in all of your work. Thanks.
Thank you, Teddy. Thanks so much. I appreciate it. I'm gonna get this.
Take this back.
Thank you, Sam. Appreciate it a lot. Next, I asked Dr. David Miners, who's our CEO at Mercy St. Louis, to share a few words as well. David and I also go back maybe more than 5 years, closer to 40 years. Dave is actually a surgeon by trade, and we've been lucky to have him as our CEO, and he's been on our organizing committee, and he's been an ardent supporter for the kind of work we're doing. So thank you, Dave, and thank you for being here.
Thanks, Dave. Thank you. Is this working? I'll just give you this. This will be brief. I just wanted to welcome everybody. How many people were here last year? Yeah, amazing. You know, Dr. Mannion came in like a year and a half ago with the idea to do this, and I kind of said, well, I know Farron, I love Farron, so anything you want to do, I'm going to support. And wasn't sure exactly how it was going to turn out. I was blown away by it last year. And so when he came back and said, hey, we want to do this again, I said, absolutely. And I think we've even got a better lineup, really, this year than we did last year. So I'm very, very excited about what you're going to hear and see today. It really is a problem for us. You know, I mean, we sit out here in beautiful West St. Louis County. You think, well, maybe it's not an issue, but we see it every day. I mean, we've got one of the busiest emergency rooms in the Midwest. And so every single day, including this morning, one of the first things you see when you come in our emergency room is there's a couple of couches out there, and there'll be somebody laying there that is clearly one of the unhoused. And then you go and you talk to the nurses at the desk and say, what's the situation there? And usually the response is, well, you know, they're unhoused and, you know, they wanted something in the emergency room, we gave it to them. And so we've given them a bus pass. And so they're waiting to leave. And I'm thinking, man, that is a Band-Aid. That's not doing anything to solve the problem. So I love it when we get a group like this together to talk about what we can do together, because again, it's not just a problem for this city, it's a problem for our entire community. I'm particularly excited about today. Now, I want to just ask a question. How many people know which musical group in the 60s made Vox amplifiers and Vox musical equipment famous? Is any? What was the Beatles? You know, when the Beatles came over in 1964, they bought this Vox equipment over. And so after that, everybody thought Vox equipment was really the bee's knees. So being the optimist, I saw that, and I think Paul McCartney may be here. Is that part of your show today? Okay, good. Well, welcome everyone. We're delighted to have you today. It's really Mercy Hospital St. Louis is honored to be able to host an event like this. Thanks for your work, Farron.
Thank you, Dave. Before I get started, just a really big thank you for all the people who have been involved in making this symposium reality. Administration, our GME, organizing committee, including many people that are on the slide. Joe, who's been an amazing AV. He's the only AV person I know that can pull off something like this, so thank you, Joe. My StreetNet family, we've been together for these couple of years, and they've been a huge inspiration to me. And I really thank them, and they've been a really very integral part of this symposium. And then all the speakers and panelists and all the participants, volunteers, every one of you, and then of course my wife Tammy, who's been my amazing supporter throughout all this, this activity that I've been involved with in the last few years. And just a reminder, please mute your cell phones if you haven't already. Please hold your questions at the end of each presentation. There's a microphone here. Please use the microphone and introduce yourself and what organization you might be associated with. The virtual audience, you have an opportunity to send us a chat or send us a chat to us, and we can get to your questions as much as we can. There's going to be plenty of refreshment breaks and lunch break. Bathrooms are outside to your right. There's going to be also a drawing for autograph books, courtesy of Kevin Fagan. There will be several copies that will be given away, and the drawing will be this afternoon at 3:15. So strategically located in time so you can stick around that long. But you have to be here in person to claim it. And there is a QR code on all the tables. Please use it to send us a survey of how we did this year, and so that we can hopefully improve upon it next year. There's going to be a shuttle service for those who happen to be parking off-site. We will go until 5:30. And then all the sessions will be recorded, and after the conference, we will also be sending a recording for the entire symposium. Okay, and there are no disclosures of conflicts reported by any of the speakers. So I had already kind of prepared my little introductory talk a couple of weeks ago until last week on Saturday. I was with an encampment, and the usual one we go to, but there's another field that are right next to the encampment downtown St. Louis that had only one tent, and it was really off the beaten path. And I always worry about just a solitary tent way off the beaten path, what's going on in there. So my medical student scribe and I, we said, we're done with our rounds, but let's go toward that tent just to make sure everything's okay there. So we go over there, there's nobody in the tent, but on the way back, I saw this scooter, and with a message on the bottom of it, says, "Please help me up." And I looked at that and I said, this message was written by a human being on a scooter. And my rounds, the people that I see and we all see, are kind of telling us, "Please help me up." And I just said, God, this is just amazing. It's like, here's a scooter that is, nobody's going to see this scooter unless you go there. The scooter is on its side, you can't do anything unless it's actually up. You can have functioning parts, but it's no good unless it's actually up. And not only that, it's written so that it's the right side up, you can see it, but then it's also, if it turns the other way or it falls on the left side, it will give you the same message. So either way that it falls, he wants you to help it up. And it's written by a human being. And the longer it stays there like this, without being up, the less likely it's ever going to be able to be functional. And the parallel that brought me, just that one message, was, to me, it was like really impactful. And I said, well, maybe it's something I need to be sharing with the symposium. That perhaps we're not trying to make people perfect. All we want to do is just try to get them up so that they have a chance of being functional again. So it reminded me of this quote that I'll see if anybody recognizes it as who might have been the responsible party for this quote. Let us admit that for all the progress we've made, we're still illiterate when it comes to accompanying, caring for, and supporting the most frail and vulnerable members of our developed societies. We have become accustomed to looking the other way, passing by and ignoring situations until they affect us directly. It's really a profound quote. Does anybody know who actually said that? So it was Pope Francis in 2020, in his exhortation. And he wasn't talking to Catholics, he was talking to the world too. And he was trying to tell us, look, we're still pretty illiterate. Yes, we're civilized, we call ourselves civilized, but we're illiterate when it comes to actually caring for another human being. Which really made me think about, well, why is that? Why are we so illiterate? What is keeping us from being literate again? And the more I think about it, it comes down to just one thing. From my standpoint, it all has to do with dignity. Once you lose sight of another human being's dignity, it's very easy to become illiterate. And in some ways, I think that this is what's happening in our society right now. We do not see the dignity in our fellow person. We just want to just basically go right past them because we don't see the dignity. We don't make an attempt to see the dignity. Without dignity, it's very hard to become compassionate, very hard to be kind. With dignity, compassion and kindness will flow effortlessly. And that's something that I think we're all missing out on. Which also reminded me of another quote that it was really profound, because it's not just about us helping another person, it's how that help will actually shape us become human beings. So it's a two-way street. And I love this quote. Those who are marginalized do not just need our help, they help reshape our hearts toward humility and compassion. You're helping yourself by helping your fellow person. That also happened to be from the exhortation of Pope in 2025, in October, Pope Leo XIV. It was just amazing. And his whole exhortation has to do with, we need to start paying more attention to the underserved, to the poor, to the people who just need our help, and we've been ignoring them all these times. And, the whole concept is not new, obviously. Civil rights, Martin Luther King, whose birthday is actually yesterday, even though, we celebrate the day next week, but his birthday was on 15th of January. He reminded us repeatedly of the importance of recognizing dignity in our fellow human beings. And he said, when we have dignity and respect, we join the communities of human beings and they join us. We are one. You may not know this, but let me see, sorry. Maya Angelou was born in St. Louis. Does everybody know who Maya Angelou is? Who doesn't, right? She's one of my heroes. She was born here, amazing author, civil rights activist, great quotes. And she actually thought a lot about dignity, and she redefined dignity in ways that I had not thought about before. But she looked at dignity in ways that I hadn't. And she said, well, dignity really means that I deserve the best treatment I can receive. However, it's also about I have the responsibility to give the best treatment I can to other people. So it's not about like, oh, I'm just taking care, I just see your dignity. It is our responsibility to exercise that, to lead with dignity. Now, many of you don't know this, but when we talk about dignity, I would like to think of it as, yes, for people around us, we need to respect their dignity. But what about the people we don't see? What about people that are marginalized? What do we owe to them? And 200 years ago, Sisters of Mercy happened to think exactly the same way we're thinking today. We need to get out of our convents. We need to walk to people who actually need our help. Get out of the four walls of wherever you're at, or the circle of friends and relatives that, oh, we are very comfortable. Of course, we treat them with dignity. But what about people that are not getting the respect for their dignity? What about them? What are you doing about them? So the Sisters of Mercy, 200 years ago in Dublin, says, we're going to go out there, which was, I think, against the rules at the time. But no, these people really need our help. So they started going out, and they were dubbed as walking sisters, because it was a very new concept. And in fact, meeting them where they are started out with their idea that we need to get out and go to people who really need our help. We can't just sit here and say, yeah, I'm doing everything I can about dignity. No, you need to go out there, exercise that, and show people who haven't seen the respect that they've gotten that, yes, there are people who really care about them.